Welcome back to All About Parenting. Today, we have a video that's going to cover some essential topics to ease your worries and provide you with valuable tips for caring for your newborn. We'll be discussing everything about baby bowel movements and constipation, so let's jump right in. One of the things we always worry about is whether or not our baby is peeing and pooping often enough. When it comes to newborn babies, their bowel movements can be quite fascinating. Initially, they pass a thick, tar-like substance known as meconium. After that, their stools start turning greenish and eventually become yellowish with little flecks of cottage cheese. It's a journey of changes and adjustments as their digestive system adapts to new feedings. So, you might notice a transition from having frequent, watery, yellowish stools when your baby is exclusively on breast milk to potentially just one bowel movement a week. This change occurs because breast milk is so efficiently absorbed that very little is left to come out as waste. Another factor contributing to these changes is that newborns were nourished through the umbilical cord during their 9 months in the womb. After birth, they begin to feed orally, and their intestinal tract needs some time to adapt to this new process. This adjustment may cause occasional backups, leading to some discomfort for the baby. Also, there is some variation in how often newborns will have bowel movements, depending upon whether they are breastfed or formula-fed. In a formula-fed baby, they usually have a bowel movement every 1 to 2 days, but they can go 2 or 3 days without one, and it can still be normal. In a breastfed infant, they may go even longer, even up to a week, without having a bowel movement. However, not having a bowel movement could also mean that they're not getting enough breast milk. But when should you start to be concerned about constipation in your newborn? The first thing you want to make sure is that they're showing good signs of hydration, like peeing often and having a moist mouth. As long as the stool appears soft and not hard like clay or pebbles, it's considered normal. If your child seems to be straining significantly to have a bowel movement, and if they strain for up to 10 minutes without producing a stool and their face turns red, it might be a good idea to consult your doctor about possible constipation. Another worrisome sign is if you observe any blood in their bowel movement, as this could indicate an infection and requires medical attention. Additionally, if you notice their stomach becoming unusually large or hard, or if they experience vomiting along with the lack of bowel movements, you should seek medical advice as it could be a rare obstruction issue. How to relieve baby constipation at home. Here are some valuable tips to help you ease your baby's discomfort and constipation. Tip number 1. The first thing you should do when your baby is in pain or discomfort is holding your baby close to your chest and providing them with a sense of security and warmth. You can gently sway or rock them back and forth to soothe them. Tip number 2 is to ensure your baby is getting enough fluids. Whether you're breastfeeding or formula feeding, it's essential to ensure that your baby stays well hydrated. Breast milk and formula provide the necessary fluids to keep their digestive system moving smoothly. However, if your baby is showing signs of constipation, then make sure you're offering your baby the breast frequently, as they may need more frequent feedings. Tip number 3 is to try gentle tummy massages. Lay your baby on their back on a soft surface and use circular motions with your fingertips on their tummy. This can help stimulate bowel movements and provide some relief. Remember, use a gentle touch and pay attention to your baby's cues to ensure their comfort. Tip number 4 is to try the bicycle leg exercise. While holding your baby in an upright position, gently move their legs in a bicycling motion. This can help move things along in their digestive system and alleviate constipation. Tip number 5. If your baby is at least a month old and experiencing constipation, you can try giving them some fruit juice. The sugars in the juice can stimulate bowel movements. Just remember not to give them too much. 1 ounce of fruit juice for every month they are old should be sufficient. And last but not least, tip number 6 is to consider using a glycerin suppository or a rectal thermometer for infants under 6 months old, if recommended by your pediatrician. These can help stimulate the rectum and encourage bowel movements in cases of severe constipation. Remember, constipation can be a common occurrence in newborns, but if you're concerned or your baby's discomfort persists, always reach out to your pediatrician for guidance and support. If you found these tips helpful, don't forget to give this video a thumbs up and subscribe to our channel for more valuable content. Until next time, happy parenting.